I need you to do something right now before we go any further. I need you to take off your shoes and your socks and actually look at your feet. Not a quick glance, actually look. Because what I am about to walk you through today, 9 specific warning signs that appear in the feet, often years before a formal diabetes diagnosis, are things that millions of people are walking around with right now, noticing but dismissing, attributing to aging or tiredness or ill-fitting shoes, never once connecting them to a metabolic crisis that is quietly unfolding in their body. The feet are not just the foundation that carries you through your day. They are one of the most diagnostically revealing windows into your internal health that exists on the human body, particularly when it comes to the blood sugar dysregulation and nerve and vascular damage that define diabetes and prediabetes. And the signs that appear there are not subtle, mysterious, or difficult to identify once you know what you are looking for. They are visible, they are specific, and they are telling you something critically important long before your blood sugar numbers become alarming enough to trigger a diagnosis in a standard annual physical. My name is Dr. James. Welcome back to the channel, and today I am going to teach you exactly what to look for, what each sign means biologically, and what you need to do if you see it. Before I walk you through the 9 signs, I want to make sure you understand why the feet are so specifically and so disproportionately affected by diabetes and prediabetes compared to other parts of the body. The answer lies in 2 fundamental mechanisms of diabetic damage: peripheral neuropathy and peripheral vascular disease, both of which affect the extremities first and most severely because of basic anatomy and physiology. The nerves that serve your feet are the longest nerves in your body. The sciatic nerve and its branches travel from your lower spinal cord all the way to the tips of your toes, a distance of 3 to 4 feet in the average adult. Long nerves are metabolically expensive to maintain and exquisitely vulnerable to the toxic effects of chronically elevated blood sugar. Glucose at high concentrations damages the myelin sheath, the protective coating around nerve fibers, through a process of glycation, where glucose molecules attach to proteins and alter their structure and function. It also damages the tiny blood vessels, called vasa nervorum, that supply the nerves themselves with oxygen and nutrients. Because the damage accumulates proportionally with nerve length, the feet and lower legs show nerve damage earlier and more severely than any other peripheral location. The blood vessels that supply the feet are similarly at the end of the longest vascular pathways in the body, under the highest cumulative resistance, most vulnerable to the inflammatory and structural damage that chronic hyperglycemia produces in arterial walls. This combination, the most vulnerable nerves and the most vulnerable blood vessels in the same location, is why the feet serve as the earliest warning system for the metabolic damage of diabetes, and it is why learning to read the signs your feet are sending you is one of the most valuable health literacy skills any adult can have. The first warning sign is persistent numbness or tingling in the feet or toes, the symptom that most people have heard associated with diabetes, but that most people dramatically underestimate in its significance. The tingling that diabetic peripheral neuropathy produces, often described as pins and needles, a buzzing sensation, or a feeling like the foot has fallen asleep, is the direct neurological consequence of myelin sheath damage in the sensory nerve fibers of the lower extremities. It typically begins in the toes and the ball of the foot and progresses proximally up the foot and lower leg over time as nerve damage accumulates. What makes this sign so critical is not just what it tells you about nerve health, it is what it tells you about the duration of the blood sugar problem. Peripheral neuropathy in the feet takes months to years of chronically elevated blood sugar to develop, which means that by the time you feel that tingling, your blood sugar has likely been elevated well above optimal for a significant period of time. Many people experience this symptom, attribute it to sitting in an awkward position or wearing tight shoes, and never report it to a physician. If you are experiencing persistent or recurrent tingling in your feet that is not clearly explained by a positional or mechanical cause, this symptom warrants an urgent blood sugar evaluation. The second warning sign is burning pain in the feet, particularly at night. Diabetic neuropathy does not always present as numbness in its early and middle stages. It frequently presents as a burning, aching, or shooting pain that is often worse at night when the feet are warm and at rest, and when there are no competing sensory stimuli to mask it. The burning sensation is produced by damaged nerve fibers that are misfiring, sending pain signals in the absence of any tissue injury, essentially creating pain from the nerve damage itself rather than from any external stimulus. Night burning foot pain is one of the most commonly reported early symptoms of diabetic neuropathy and is frequently misattributed to poor circulation, tired feet, or simply getting older. If you are regularly waking up with burning feet or spending your evenings with a persistent burning sensation in your feet that is not explained by an obvious cause like athlete's foot or contact dermatitis, this is a sign that should be evaluated for metabolic causes without delay. The third warning sign is changes in skin color or temperature specifically, skin that appears unusually pale, red, or has a bluish or mottled discoloration, or feet that feel significantly colder than the rest of the body. These color and temperature changes reflect the peripheral vascular damage that chronic hyperglycemia causes in the arterial supply to the feet, when the small and medium arteries supplying the feet are damaged by glycation, inflammation, and atherosclerosis. Blood flow to the feet is reduced. The skin, deprived of adequate circulation, may appear pale or waxy when the foot is elevated and turn deep red when it is lowered, a sign called dependent rubor that is one of the classic clinical indicators of peripheral arterial disease. Coldness in the feet that is disproportionate to the ambient temperature, or a marked temperature difference between the 2 feet, reflects asymmetric arterial compromise. If you regularly notice that your feet are unusually cold when the rest of your body is warm, or that the skin color of your feet changes noticeably with position or temperature, these are vascular warning signs that deserve medical evaluation. The fourth warning sign is extremely dry, cracked, or peeling skin on the feet, particularly along the heels and the sides of the foot. The autonomic nerve fibers that control sweat gland activity in the feet are among the earliest nerve populations affected by diabetic neuropathy. When these autonomic fibers are damaged, the feet lose their ability to sweat normally, producing the characteristically dry, rough, thick skin that is one of the earliest and most consistent physical signs of early diabetic peripheral neuropathy. The skin of the feet becomes unable to maintain its normal moisture barrier, leading to dryness, scaling, cracking, and the development of deep fissures, particularly in the heels, that can become portals for infection. In people with established diabetes, these heel fissures are a serious clinical concern, because the impaired immune function and reduced blood flow of poorly controlled diabetes make foot infections extraordinarily difficult to treat. But as a warning sign of early or pre-diabetic metabolic dysfunction, dry, cracked feet, particularly in a person who does not have any obvious skin condition or environmental explanation for the dryness, deserve metabolic investigation. The fifth warning sign is slow healing of cuts, blisters, or sores on the feet. This is one of the most serious warning signs on this list and one that demands the most urgent medical attention. The healing of even minor skin wounds requires adequate blood flow to deliver oxygen, immune cells, and growth factors to the damaged tissue, and adequate nerve function to coordinate the inflammatory and repair responses. Both of these requirements are compromised by diabetes. The peripheral vascular disease reduces blood flow and oxygen delivery, and the peripheral neuropathy impairs the neurologically mediated aspects of wound healing. The result is wounds that heal at a fraction of normal speed, that are prone to infection, and that, in the context of established diabetes, can progress to diabetic foot ulcers, chronic, non-healing wounds that are the leading cause of non-traumatic lower extremity amputation in the developed world. If you notice that minor cuts or blisters on your feet are taking significantly longer to heal than they used to, or that they become infected more readily than similar wounds on other parts of your body, this is a warning sign of compromised diabetic healing that warrants immediate medical evaluation. The sixth warning sign is recurrent fungal infections of the feet or toenails, athlete's foot, and onychomycosis, the thick, yellowed, crumbly nail infection caused by fungal invasion of the nail plate. Fungi thrive in warm, glucose-rich environments, and the elevated glucose levels in the skin and sweat of people with uncontrolled or undiagnosed diabetes create precisely the environment that fungal organisms prefer. The immune dysfunction associated with chronic hyperglycemia further reduces the body's ability to fight off fungal infections once they establish, leading to the recurrent treatment-resistant athlete's foot and the chronic nail fungal infections that are seen so commonly in diabetic feet. If you find yourself repeatedly treating athlete's foot that keeps coming back, or if you have persistent nail fungal infections that do not respond adequately to over-the-counter treatments, these recurrences deserve to be evaluated in the context of your blood sugar and metabolic health, rather than simply treated in isolation as skin conditions. The seventh warning sign is the development of calluses in unusual locations or calluses that grow unusually thick and rapidly. Calluses form in response to repeated pressure and friction, and in a normal foot, they develop in predictable locations based on gait mechanics. But diabetic neuropathy alters the way the foot bears weight by changing the functioning of the intrinsic foot muscles, the small muscles within the foot itself that normally distribute weight evenly across the foot's structures. When these muscles are damaged by neuropathy, the foot's mechanical loading pattern changes, creating areas of abnormal pressure concentration that produce calluses in atypical locations or calluses of unusual thickness. These pressure concentration points are clinically important not just as metabolic warning signs, but because they represent the locations where diabetic ulcers most commonly develop. The callus tissue can break down under sustained abnormal pressure, creating a wound at exactly the point where blood flow and healing capacity are most compromised. The eighth warning sign is changes in foot shape, specifically the development of a condition called Charcot foot or early features of Charcot arthropathy, which involves the progressive deformity of the foot's bony architecture due to the combined effects of severe neuropathy and continued weight bearing on a foot that has lost its normal protective pain sensation. The foot may appear swollen, red, and warm, resembling an infection, but without the typical infectious cause. Bones within the foot can fracture without the person feeling significant pain because the neuropathic damage has abolished normal pain sensation. And these fractures, undetected and untreated, allow the foot's bony architecture to progressively collapse and deform. Charcot foot is a severe complication of established diabetic neuropathy, but the early warning signs, unexplained foot swelling, warmth, or subtle changes in foot shape can appear before the condition is fully established and before a formal diabetes diagnosis has been made in some cases. The ninth and final warning sign is hair loss on the lower legs and feet. The fine hair that normally grows on the lower legs and the dorsum of the feet depends on adequate blood flow for its growth. When peripheral arterial disease reduces blood supply to the lower extremities, one of the earliest visible signs is the loss of this hair. The hair follicles, deprived of the circulation they need to function, simply stop producing hair. Many people notice this change and attribute it to age or to the mechanical effects of wearing socks, never connecting it to the vascular compromise that is its actual cause. Running your hand along your lower legs and the top of your feet and noticing that the hair that used to be there has become sparse or absent, particularly if this change has occurred gradually over the past few years, is a vascular warning sign that deserves attention in the context of a complete cardiovascular and metabolic risk assessment. What I want you to understand about all 9 of these signs is that they are not independent random findings. They are expressions of the same underlying metabolic and vascular damage, the toxic effects of chronically elevated glucose on nerves, blood vessels, immune function, and tissue healing. And when you see more than one of them in the same feet, the signal becomes significantly stronger and the urgency significantly greater. A single dry heel might be nothing more than a dry heel. Dry heels combined with tingling toes, combined with slow healing blisters, combined with recurrent athlete's foot in a person over 55 who has not had a blood sugar check recently is a constellation of findings that demands urgent metabolic evaluation. The tests you need are straightforward: a fasting blood glucose, an HbA1c, and ideally a fasting insulin level, as I discussed in a previous video. These simple blood tests can reveal the blood sugar dysregulation that the foot signs are warning you about, and catching that dysregulation at the pre-diabetes stage before the damage becomes irreversible is one of the most impactful health interventions available. Prediabetes is reversible with dietary change, exercise, and weight management in a way that established type 2 diabetes is not. The feet are telling you something. The question is whether you are listening early enough to make a difference. My name is Dr. James, and if this video gave you information that makes you look at your feet differently today, please hit that thumbs up button right now and share this with every person you know who is over 50 and has never connected their foot symptoms to their metabolic health. Leave me a comment below and tell me which of these 9 signs you have experienced and whether you are going to speak to your doctor about getting your blood sugar checked. I read every comment and genuinely care about what you share. And if you are not yet subscribed to this channel, please subscribe right now and ring that notification bell, because every week I bring you the honest, evidence-based health content that helps you catch the warning signs your body is sending before they become crises you cannot reverse. Subscribe right now. Your feet have been trying to tell you something. Now you know how to listen. I will see you in the next video.